Let's review the IG principles and examples for healthcare in more details. Accountability. Accountability means it oversees or delegates someone with proper background to oversee IG. Team could start off by defining a clear process for accountability so that it is known which department, which people are accountable for doing certain things. Because if there is no clear direction, there could be much confusion and many challenges that could possibly arrive. So it's so important to think about from an accountability standpoint. Maybe implementing stewardship programs, which is a component of data governance, but also relevant for information governance. Transparency. Organizational processes and activities are documented openly, meaning people can, we're not consolidating everything within our closed space. We're not working no longer in silos, but we're communicating with verifiable and clear information. Having open communication and a safe environments for practicing principles of transparency can not only help the organization, but it helps to get better input for overall patient care. Integrity. Data are authentic, is timely, is accurate, is complete, and reliable. Adherence to the governance policies and procedures and appropriate workforce training on information management and governance are crucial. So having that reliable information is a key component, right? It helps with audit. It helps make the more reliable systems. People feel more confident. Also, let's talk about protection. So safeguard of both manual and electronic health information, so that PHI. You want to safeguard it from breaches, from corruption, from any type of data loss. So those policies and procedures that we talked about from an integrity standpoint, really providing those best practices, can also be applied here within the documentation of the policies and procedures. Include validation of the disposal method, the time and date. Also that accountability, who's accountable for disposing that data. Compliance. Conduct activities to meet laws, regulations, policies, procedures, and standards. Information should be entered into the record to demonstrate that its activities are being conducted in a lawful manner. Maintaining the information in a manner and for the time prescribed by law or organizational policies is important to incorporate. So making sure you have that accountability as well as transparency to communicate and who's responsible for communicating the compliance around information governance. Also, making it available is key, right? It's one thing to communicate, it's another thing to make it available so that people can access, and making sure that information is available at a timely and accurate way so that you can continue to provide efficient care, right? The healthcare team, the patient, caregivers, and any authorized members of the workforce, they should be trained on these policies and on its availability. So in order to be successful, an organization may want to have legal and compliance authorities for discovery and regulatory review purposes, and internal and external reviewers for the purpose, including but not limited to payer audits, financial audits, case management, and quality assurance. Retention. An organization shall maintain its information for the appropriate time. So we talked about earlier, looking at the availability, right? Making sure that it's available. Also, making sure that we understand how long can I use this information is key to efficient care, right? When you're thinking about retention, you want to consider its legal, regulatory, fiscal, operational, risk, and historical requirements when you're documenting those policies and procedures. And then disposition. Provide proper destruction, change in ownership. So people tend to leave the organization. Who's responsible or who's that accountable individual once you have like turnover, right? You need to make sure that the change in ownership is appropriate, documented, or and then disposition includes not only just destruction, but also any permanent change in custodianship of the information. So, such as when it is transferred to another party, we just talked about this, due to a merger. So, this is from a corporate level, right? When there's mergers or acquisitions, not just the individual level where we're looking for accountability from a stewardship perspective. But what happens when that organization merge or there's an acquisition? We need to consider the disposition from that standpoint as well. When an organization discontinues a practice or a service or other business. So that ends this part of the session where we have identified the IG principles and reviewed each example.